In the Henry Ford Health System, after 14 people at one hospital became ill with salmonella poisoning. The hospital says there's no evidence the outbreak is linked to food. So how does this happen? 7 Action News reporter Tara Edwards is on the case for us.
Right now, it remains a mystery exactly how 14 patients here at Henry Ford Hospital ended up with stomach flu-like symptoms. But it appears they all have a strain of salmonella. The hospital would not comment on camera, but released this statement, quote, "No new patients have been identified this week. There is no evidence at this time the illness is food-related." They add they are currently working with the Michigan Department of Health and Human Services to investigate how this could happen.
Currently, we are working with the hospital to determine the cause of the outbreak and to also determine how many patients may have been affected.
According to Henry Ford Hospital, salmonella is not typically life-threatening and in most cases goes away in less than a week, even if untreated. Investigators tell me they are hoping to have more answers about these cases as soon as possible. 7 patients are still in the hospital. We're told they're doing well. They have been isolated as a precaution. At Henry Ford Hospital, Tara Edwards, 7 Action News.
And now we bring in Chief Health Editor Dr. Partha Nandi to talk more about this.
And Doc, when you think of salmonella outbreaks, we always think of them being linked to food, but how else can someone come in contact with it?
You know, what happens is that if you touch someone who has, for example, hasn't washed their hands and they've changed a dirty diaper, for example, you can get salmonella that way. Also, if you have pet birds or reptiles, you can get it that way. So it doesn't always have to be with food. So in this setting, it looks like, you know, the hospital is doing the right thing and they've really got it under control.
All right, Dr. Nandi, what should people do if they get sick, and what should they look for?
That's important. You know, they can get nausea, vomiting, diarrhea is the main symptoms. So keep yourself, rehydrated, right? So just eat very light foods, make sure you get a lot of fluids, and maintain your hydration. That's the key, and most people, it just goes away in a few days.
Many people self-medicate and then go to bed, Doc. So how do we know when it's time to come see a doctor?
First of all, if you're young, if you have a young child or an infant, definitely see a doctor. Pregnant women, immunocompromised women with transplants or the immune system is somewhat compromised, then see a doctor. Also, if this is lasting more than a few days, or if you have fevers, if you have bloody stools, time to see a doctor. So, but most of the time people do fine. But those situations, please see a doctor right away because they can get treated and we can control this.
All right, Dr. Nandi, as always, we thank you for your time and your medical expertise.
My pleasure.